Fueled in part by the devastating second wave burning through India, the number of global cases of COVID-19 has been on the rise for 9 consecutive weeks. As you can see on this map of cumulative COVID-19 cases by Johns Hopkins University, India is not the only place in Asia hit hard. Cases are spiking in neighboring Nepal. The border city of Nepalganj has become a COVID-19 hotspot. Local lockdowns have been imposed in cities including Kathmandu, and there have been reports that tourists at Mount Everest base camp were infected, but the Nepalese government has denied this. Other neighbors are not taking any chances. Pakistan has deployed the army in 16 cities to enforce pandemic safety protocols. Bangladesh has imposed a strict lockdown. On Monday, it sealed its border with India for 14 days. The trade will continue. Meanwhile, Sri Lanka is bracing for a third wave of infection. Local media report that all ICU beds in hospitals are full after Sri Lanka detected a new variant over the weekend. And starting Wednesday, schools across the country will close. Residents in designated areas are required to remain indoors, and a police curfew is in force. Indonesia is also battling one of the worst COVID-19 outbreaks in Asia, with over 1.65 million infections since the pandemic began. To prevent the spread of the new variant, Indonesia has stopped issuing visas for travelers who recently spent time in India. And this week, the Philippines logged its 1 millionth case of the virus, a grim new milestone as it struggles to boost healthcare capacity. About 16 months after the virus was first identified in China, the surrounding region is being ravaged again, and medical workers across Asia are struggling to push back the pandemic. Kristie Lu Stout, CNN, Hong Kong.